8 years old lady suffering from right-sided headache, most probably cluster headache, because she has tears also in the right eye and right-sided headache since many years. And she took so many migraine controlling drugs and muscle laxant and painkillers, but she did not have much of relief. And now we opted for the Sphenopalatine Ganglion on the right side. And we had a good stimulation at only 0.2 volt for in the nasal base of the nose on the right side. And now we are doing her radiofrequency ablation at 70 degrees Celsius for 60 seconds at multiple points over here. And hopefully she will improve and will get relief from the headache. So when we do the landmarking is very important in it, because this is a spherical structure, and sometimes it is very hard to reach your target and have a good direction of that. The point is that if it is a right-sided Sphenopalatine, you should stand on the head side of the patient if you are a right-handed person, and the screen should be in front of you, so you don't need to twist yourself and look back. And number two, the position of the screen should be same as is the position of the patient on the table. So it gives you very good orientation. And if you look here closely, you see this is a line which I marked, just putting my cursor, just this marker on along the length of the Sphenopalatine. So this line will help me in the direction of the cannula to reach my target easily. And this other line, this is the other line which I draw here roughly. This is actually the zygomatic bone, and your target entry point will be right on this line which you draw along the Sphenopalatine. So it helps you a lot in reaching your target safely and with ease. So this landmarking we draw before we start the procedure, before we scrub and clean the patient with antiseptic solutions, and then we fix the head, if you think, in the position in the lateral, because this is the best way. So when we think we are right there, or patient says there is some stimulation or some pain in the nose or something like that, or you feel some obstruction or some on your way, then it means you have reached the lateral wall of the nose. So you stop it and you look in the AP view. AP view will show you that you are just touching the lateral wall of the nose. Sometimes there is anatomical changes in the face of the patient because of some nasal pathologies. So you should look everything and keep in mind everything to reach your target correctly. And when you give the local anesthetic or some fluid, always ask the patient if she had any fluid in the nose or not, because sometimes you can rupture the lateral wall and you can cause the epistax in the patient. This is one of the complications we do during this. And secondly, you should be very careful, because you are just passing under the orbit. So never force your cannula, because you may enter the orbit and damage the eyeball. These are the few immediate complications which can be faced during the procedures. So always be gentle and never force your cannula without realizing where you are. Okay, this will save you from a lot of issues and a lot of complications. Thank you very much.